I grew up in Jackson, Mississippi, and went to Mississippi State, where I majored in general science. And after that, I went to the University Medical Center in Jackson for medical school. And then after that, I went to University of South Carolina in Charleston, where I did general medicine for 3 years. At that time, I decided to go into cardiovascular specialties, and I did 3 additional years at Baylor Hospital in Dallas, where I did general cardiology and invasive cardiology. Then I did 1 additional year of interventional cardiology in Arizona, where I learned more about catheter procedures for coronary interventions as well as peripheral interventions. So when I finished my training, I came back to Mississippi in 2004. I've been in practice since that time, and I've recently moved to Baptist in 2015. Really enjoyed joining the team here, and it's a great place to practice medicine. I chose cardiology because the cardiovascular system is interesting to me. Also, I have grandparents on both sides who have cardiovascular disease, and so that impacted me, when I was younger. And then when I was in medical school, I had several patients that when I was on the cardiology services there as a student, that their care that I interacted with impacted me in a way that made me more interested in wanting to help people with those types of conditions. And so when I was trying to narrow down what type of physician, that really influenced me. Additionally, in the last 30 years, there's been a lot of advancements in cardiovascular treatments, and both in the knowledge of what's driving those conditions and also treatments. And so cardiology is kind of a combination of old technology from stethoscopes and EKGs, which have been around for a long time, to newer therapies, like CT, angiography, ultrasound, catheter-based therapies that we can now use, which really can help a lot of people in a less invasive way. So my philosophy for patient care grows out of my desire to help patients. I want to help them understand their cardiac condition. I want them to understand the best treatment that's recommended for them, and also what they can do to help prevent future problems. And I try to do that in a way like I would want my family to be treated if they're in that situation. So my mission as a physician is to use the talents and the knowledge that God has given me to try to help patients have better life. I want to help them understand their cardiac condition and ways that we can help them both with therapies but also with knowledge. I want them to understand how they can make better lifestyle choices that will impact them not just now but in the future in a positive way.